This is Heart Rhythm TV. I'm Roderick Tung. With me, we have Andrew Krahn, Second Vice President and the chair of this year's abstract sessions. Andrew, welcome.
Thank you.
Andrew, you are going to be moderating a late breaking session, and obviously everyone's starving for some new EP science, and the late breakers are always the hot ticket in town. You have the pleasure of having the randomized controlled trial session. Can you tell us a little bit about that and what we're looking forward to?
Well, I'm really excited about it. I suppose it's chairperson's prerogative that I get to pick and engineer the first one on randomized data. You know, we have a bunch of different forms of science. We have 4 sessions planned, and this one has a focus really on comparative science, different realms within the late breaker kind of envelope. So, and we intentionally engineered it in such a way so that there's some things that affect all of the elements of a EP service. And so a good example is we have something on devices. What's the best platform of devices? We have the Praetorian trial. We have some incremental new drugs. We have an intranasal calcium channel blocker and see how it affects termination of SVT. We have different kinds of things around the ablation spectrum. So for example, we have something using a combined surgical and endocardial approach to PV ablation to see whether we can affect the outcome of atrial fibrillation ablation. We have the use of smartphones as tools for patients to try to enhance the quality and adherence to medication. And we have our first formal FDA weigh-in on the whole area of the effectiveness of persistent AF ablation. So each of these has with it a comparator arm. It has a focus on the question of whether we can really transform our practice. And so there'll be take-home messages and a chat thereafter talking about what do I do now that this new evidence is out there? How will peer review put that into context and then inform our guidelines in our practice?
Perfect. And then when you're moderating these sessions, I understand that we have a new feature in this virtual late breaker where we have hawks and doves. Can you tell us a little bit about these birds?
Yeah, you know, when I was growing up through training, if you like, there was always the talk about the examiners, and the examiners were the dove and the hawk, the nice guy, good cop and bad cop kind of thing. So I devised this kind of terminology to say what we wanted with the commentator role was somebody who was a bit of a cynic, who would say respectfully, you know, I think there's some concerns about the applicability or the design of the study and so on. And then the dove who would say, I think this is really exciting new evidence and I think it's going to affect how we do things. And those two, if you like, perspectives are going to enhance the audience experience to see what a recognized expert, who those doves and hawks are, puts new data into context and then how we would apply it in practice.
Well, now I know how you feel about me because you put me as a hawk and that means you think I'm cynical. So I appreciate the opportunity, but all of us appreciate your efforts. And I think that we'll all be tuning into Late Breakers the same way. It may not be that big grand ballroom, but the science is equally the same and the message will be the same. So thank you very much. And we'll see you all at Late Breakers this year.
You bet. See you there.